guys, welcome back to my channel. My name is Susan. I am so happy that you are here. Today's video is a life update. I realized that throughout Vlogmas I had dabbled in my brain tumor journey, but I haven't done a sit down video where I explain exactly where we are and what we're doing in 3 months. So I'm going to catch you up to speed and talk to you about what the plan is, how I'm doing, and just all of the things. I've been getting a lot of DMs and questions about it, so I figure why not just sit down and let's talk about everything. If you are new here, to catch you up to speed, my name is Susan. I'm a first-time mom, and when I was 3.5 months postpartum, I was diagnosed with a brain tumor. The last life update video was me meeting my first neurosurgeon for the first time and what was to come. It was the list of to-dos essentially that we needed to do for testing. I have done all of that testing now, and we know a lot more, not a lot, but we know more about the tumor, and now we are in the process of getting a treatment plan. So today's video covers everything, and let's just jump into it. What we know about the tumor itself: after a series of MRIs, I had an MRI with and without contrast, with perfusion, and an MR spectroscopy, which shows essentially the chemical composition of the tumor. Those scans ended up resulting in ruling it as a tumor, not a lesion. All tumors are lesions, not all lesions are tumors. This is definitely a growth of some kind, and it measures about 2 centimeters in size, and it appears slow growing, which is really good news given the circumstances. And it is isolated to the occipital lobe pole. So the occipital lobe controls your vision. The occipital lobe pole is where essentially everything meets. Picture like an electrical something, all the wires meeting to make something work. That is where this tumor is located. So all the wires meeting to make my right-sided vision work is exactly where this tumor is sitting. So that is why when I was having seizures because of the tumor, it was appearing in my right-sided vision, which I will show you what that looked like. This is what it looks like to have a brain tumor from my perspective. My tumor is in my occipital lobe, which controls the right side of my vision. Everything I'm about to show you is only ever on the right side of my vision. And what I'm seeing is actually seizure activity caused from the brain tumor. When I was 2 weeks postpartum, I started seeing colors like this. I thought they were ocular migraines and assumed they were hormone related. As going back to work got closer, I started getting more stress, and it turned into something like this. These bright, flashy lights would kind of move in a circular motion, and it would take up to 80% of my vision on my right side. And they were more circular like this. By the time I got back to work, this was happening up to 15 times a day. And then directly after this would happen, I would have this blurriness that would last up to 10 minutes. This is a really good image of like what it would look like when it was happening. This is another pretty accurate representation of what was happening. This was happening every day for months, and then I had a grand mal seizure, which is what diagnosed the tumor. Touching it, removing it, the likelihood of my vision on the right side being affected is very high. Let's catch up on seizures. As you guys know, the visual seizures were the main symptom of the brain tumor. The seizures started when I was about 2 weeks postpartum. I thought I was having ocular migraines and assumed it was hormone related. I've had migraines in the past. I chalked it up to that for weeks 2 to 6. And then at my 6-week OB appointment, I brought it up to my doctor and I explained what was going on. And he did not agree that it was hormone related. He didn't feel comfortable signing off on that. So he referred me back to my PCP and neurology for them to follow up. My PCP saw me first. They put me on magnesium and my symptoms improved significantly. I now know that magnesium also treats seizure symptoms, not just migraine symptoms. I am a new mom. I had used all my PTO for my maternity leave, so I didn't have a lot of time to be working with to go to a neurologist appointment, which was over an hour and a half away. And I am placing no blame on anyone. This is just the way things run. So when neurology called me a few weeks later and asked to set up my appointment, I explained that I didn't have a lot of time. My PCP had put me on magnesium. The magnesium was working really well. My symptoms had improved significantly, and they agreed that they didn't think I needed to come down. They were like, this seems to be getting better. We don't need to see you. Fast forward to 3.5 months postpartum, I'm playing at a soccer game, and that is when I have the same type of ocular, what I thought was a migraine. It gets blurry and there were some colors, but I was playing in a soccer game and I didn't want to get hit with the ball simply because I couldn't see. I step off the field to where my family is and my right arm goes straight up and my head gets cocked and I can't move and I thought I was speaking, but I was not speaking. My brother-in-law is a first responder. He immediately recognized what was happening. He was like, get her on the ground. I remember being laying down and I could see my dad and he was screaming, call 911. I don't remember actually hitting the grass of laying down. And then when I woke up, I was in the back of an ambulance and I couldn't remember anything. I knew where my daughter was in my sister's arms, and I knew that my husband was somewhere around. And I could tell through the back window where I was geographically, but I did not know why I was there. I didn't know my name. I didn't know where I worked. I could not remember anything. It was like someone had hit a race on that entire day, but because I couldn't remember that day, I couldn't place the year, who was the president, where I work, what I do for work, anything like that. I get brought to the ER, does a CT scan, and that is where they found the tumor. In the ER, they put me on Keppra, which is an anti-seizure medicine. They thought I also had epilepsy at the time. We now know I don't have epilepsy. All the seizures are tumor related. Either way, I needed to be on an anti-seizure medicine. They put me on Keppra. I had not experienced any partial seizures for the first month that I was on the Keppra. They literally stopped. Like that grand mal seizure was the last time I had any ocular disturbances. The week before Thanksgiving, I had 10 partial seizures within an hour. So they doubled my Keppra anti-seizure medicine portion of this update. So they put me on Keppra, they doubled it. I did not do well with the doubling of the medicine. So I'm currently on Keppra, but I have experienced really bad side effects. So I want to talk about those side effects because I don't think they're talked about a lot, and these are just signs and symptoms that maybe you are experiencing that you don't realize are associated with your medicine. So the Keppra side effects, I have absolutely no appetite, which is unlike me. If you know me, before the seizure, I could eat my husband under the table. No appetite whatsoever, which has affected me in more ways than one, especially while breastfeeding. Depression, anxiety, which could be byproducts of just what I'm going through right now, but I do think that they are part of the Keppra. Keppra is a depressant, which that tracks with that. Like I said, they had doubled my dosage when I had those mini seizures. So this is the week before Thanksgiving. The week of Thanksgiving, I started having very bad thoughts. I don't know what gets flagged on YouTube. The sun is getting interesting. But I was having thoughts of unaliving myself. I have never had intrusive thoughts like that, and I knew that that was very out of character. I had no desire to do any of these things that were coming into my head, but they were popping into my head, becoming more frequent. And so I told Chris what was going on, and we got a hold of my medical team and explained that these were some of the side effects I was experiencing, and they agreed this is not a good fit for you if you're having not one but 4 of these side effects. Everyone that I spoke to, the neuropsychologist, my neurosurgeon, and then the neurologist, everyone was on the same page that this was not a good fit for me, the Keppra. They're switching me onto lamotrigine. That is a long process. It's a 10-week process. It is every 2 weeks they double the dose, and then at 10 weeks, I think around there, I go and get my blood drawn. They make sure that the levels of my blood, the Keppra and the lamotrigine, match, and then they start weaning me off the Keppra. So it is not quick, it is slow, but I'm very thankful that they agreed and are willing to change this medicine, because I really would like my life back a bit. I mean, my whole life is flipped upside down since the tumor diagnosis, but to just not feel so depressed and anxiety ridden would be much appreciated. And I'd like my appetite back. That is something that we had to advocate for. And again, I mean, I've been experiencing these not really bad side effects of it since November. It's now the middle of January, and I will not even be off of the Keppra until February, March time. So it's a process. From the week of Christmas up until January 13th have been experiencing partial seizures a couple times a day. Triggers for seizures are sleep disruptions, stress, and adding a new anti-seizure medicine can all cause seizures. The holidays are stressful. It was our first holiday with a baby, well, our first Christmas with a baby. So I, as a mom, had a lot of stress on myself to make it special for her, even though she's not going to remember it. I wanted it to be special. We went to 9 holiday events, which was much too many. And then Julia went through, I think, developmental stage where she was waking up multiple times a night. I had better sleep when she was a newborn than I did in this chunk of time, which is not her fault. I get it. But the sleep disruptions definitely didn't help with the seizure activity for me. We are working on sleep, which she is getting much better at. And my stress levels I have mitigated so that they're a lot lower. And then obviously with the new seizure medicine, the dosage, still gonna probably have some seizure activity, but that's where we're at with that. The other part with the anti-seizure medicine is that no form of treatment can start until I'm 100% adjusted to the new anti-seizure medicine, and it needs to be like ironclad. I cannot be having any partial seizures, no seizure activity whatsoever before we can do any form of treatment. Testing. So let's talk about all of the testing that I have undergone in the last couple of months. So obviously MRIs, I had a series of them, and the results of that were it declared it a tumor and it has not grown from October to December, which is great news. The MRI itself was an experience. They don't let anyone go back with you. I have passed out with needles essentially my whole life. It was the first time I got an IV without a support person. Very much like a machine, the way they do MRIs at this specific hospital, which I totally understand. They bring you out back, you change into these like outfits, or MRI safe, like a hospital gown essentially. Then you go into this, what is literally called an IV room. They give you an IV. She had me sit in a chair and I was like, dog, this is not gonna work. So they put me on a bed and then I was feeling woozy. Then after you get your IV and after it had been probably 10 minutes of me laying down, I was like, okay, I'm ready. And we walked down this very long hallway to the actual MRI machine. Standing there, there's he was like a liaison. He got me through each step of the way. He was probably an RN or something, but was with me. And then there were 2 MRI, they're not technicians. Someone told me in my TikTok comments what they were called. MRI something. I am so sorry. People who do the MRI taking. There was 2 of them. I was standing outside the MRI machine and all of a sudden I thought I was going to pass out. So I just pull up a chair at their desk and then I ended up passing out. We're pretty close to passing out. They lay me down. Long story short. And as they put the cage over my face, they asked me what music I wanted to listen to. I said Taylor Swift, of course. And I'm not even kidding. As the machine started to like push me into the machine, Safe and Sound came on and the lyrics were just close your eyes, you'll be all right, you're safe and sound, something like that, which was like move me to tears. I needed that at that exact moment. Oh, and they didn't order my anti-anxiety medicine for the MRIs, so I get a little claustrophobic. I had to raw dog this situation because they didn't put the orders in, even though I talked to someone the day before and they assured me they could give me the medicine. And so I had to be very brave that day. And I did it because if I didn't do it, it took me a month and a half to get these MRIs to even be scheduled. There was no way I was giving up that spot in line, but I was very brave. And I sat in that machine for a little over an hour. Next series of testing I went through was a neuropsychological evaluation. This gives my cognitive baseline to see, 1, if there were any deficits from the grand mal seizure, and 2, so I have a baseline if I have surgery, which is more of a when at this point, to see, then they will test against it and they will compare my scores. This was a series of puzzles. Wow. Holy smokes, that is bright. Series of intense puzzles, pattern identification, memory, and word games. about 4 hours of testing. It kind of felt like when you're a little kid and they do like the reading testing. It felt very similar to that, but like I said, it was motor skills. I was putting keys in things, and then she would read me a story. I had to tell her back as much information as I could. They showed me patterns, and I had to like pick what would be next. They would show me a picture and then take it away, and I had to draw the pictures, a lot of that stuff. I remember leaving there so angry and upset. One of the things was I had to list all the words that started with S. I had like 60 seconds and I could only think of 10 words that started with the letter S. That is something that used to be very, very easy for me. I had also expressed with them the frustrations I was having with the testing and that sort of thing. And they were the first ones to say, I think Keppra is a bad fit for you. Your cognitive abilities are there. I scored in the high functioning category, but I'm just having a hard time accessing that cognitive ability because of the Keppra, which is blocking it. It's blocking the seizures, but it's also blocking my ability to access that higher thinking. Next set of testing was at the neuro-ophthalmologist. So because my seizures were presenting as visual obstructions, they wanted to make sure that I had no serious, what's the word? Damage, we'll call it damage. They wanted to make sure I had no permanent damage to my eyes already from all of the seizures that I had been sustaining. So that consisted of a classic eye exam. I have 20/20 vision, by the way. I'm going to brag because all of this stuff I'm going through, I'm going to take the wins where I can get them. So 20/20 vision. Then I did a visual field test. You put your eyes in these like goggle things, and it's a big machine, and then they give you a clicker, and they like light up different little areas. Like they are very small little lights. They look like fireflies, and every time you see a light, you click the button. I scored very well on that. They studied each layer of my eyes from the front all the way to the back. I just looked into like a machine, again, kind of a goggle situation, and it showed different pictures and lights and whatever. So that's how they did that. And then they took pictures of my eyes, which was, again, a different form of putting my face in goggles, and they took pictures of my eyes. I really liked the ophthalmologist that I met with. She was very sweet. I really liked her. Like, if she wasn't my doctor, I feel like we would be friends. And then therapy. I have been going to therapy since the diagnosis, and we can do a whole video on therapy and what I've learned from it. But the biggest thing to sum that up is just because I carry the load well doesn't mean it's not heavy. This is really hard. Like, having a brain tumor is hard. Being a new mom is hard. So having a place where I can just kind of unload that and not feel like a burden to my friends or family, or like a broken record, has been very freeing, to say the least. Let's talk about treatment options. So this part is going to be a little raw, and I'm going to try to hold my composure for your guys' sake. No one likes to watch a video of someone crying. We had a phone call with a neurosurgeon last night, so that's why this is a little bit raw. Treatment options are repeat scans, and we follow it. Radiation, laser therapy, a biopsy, or surgery to remove it. Based off of what the first two doctors I had met with, surgery seemed like the last option. With the doctor I spoke to last night, it was the first option, which I think is just the contrast of it. You hear brain tumor and you assume surgery. Like, you hear tumor, take it out. For some reason, probably because based off of what I have been told from the first 3 months of this process, was surgery's last option. The conservative approach of it being last option was based on the fact that this tumor is in my occipital lobe, which is, like I said, where all the wires meet and I have the ability to see. The likelihood that my vision is disrupted, if not completely taken away, on my right side is very, very high. Losing the vision on my right side is a very small price to pay to live, but it is still a cost. I'm not ready to lose the right side of my world, which maybe it's selfish. But I knew that this was a probability. I knew that this was a possibility. I've known that from the get-go. But now having someone directly say, I want to take this out, it is your best odds essentially. But there is a very high probability and possibility that your vision is going to be disrupted, if not lost. And they want to take it out as soon as possible after I'm adjusted to my anti-seizure medicine. It makes it real. And where I kind of had the expectation that surgery was last resort, and now having someone say, no, I think this is the best first option, it's just a stark contrast. And knowing that that option is likely going to result in that deficit is hard. And then there's just risks with surgery. I'm sorry, guys. But I told you I would be thank you, Maggie. I told you I would be transparent with this journey, which is why I'm sharing all of it. Kind of lost my train of thought there. That surgery is now kind of the first option, and that I very well could lose the vision on my right side. That's a tough pill to swallow. I mean, shut one eye and see what it's like. It's kind of scary. And then there are other risks that just naturally come with surgery, stroke, deficits, needing physical therapy to relearn how to move. It's your brain, so touching any of it can really mess things up quickly. And I have factor 5 Leiden. I'm heterozygous, so it is the lesser of the two. My probability of having a blood clot is lesser than if I was homeozygous, but it's still another risk factor that's kind of stacked against me. I don't want to lose my vision on my right side. And again, I know that it's a small price to pay to be alive, to get to see my daughter grow up, but it's still hard. And I'm 24 and I'm kind of pissed, like I shouldn't have to make this sacrifice. But it doesn't matter what I should or could, or this is the hand I was dealt that I need to deal with. I keep thinking about if for when I have this surgery, having to say goodbye to Julia, just for me to go down and have the surgery done, and not knowing if that's the last time I'll see her, like, the way that I've seen her my whole life. And I know that I'm very fortunate that I'll still have vision on my left side, but it's just really scary. It's heavy and it's hard. And I am very much processing this in real time. So thank you for just sharing and holding this space for me. I'm posing this to be transparent, I'm not garnering or looking for sympathy. I guess if you know someone who's in a situation like this, like, I hope that this can give you some insight to what it's like and maybe help with empathy. But yeah, so how we're making the decision on treatment. I have 2 separate tumor boards assessing my case, and we will take both of their recommendations. We're currently waiting for said recommendations, because if you're not in the healthcare system, and specifically in the department that I need healthcare in, if you're not waiting, you're actively dying. So I'm happy to hold my space in line, but it's a waiting game, and I'm learning how to be comfortable in the unknown and not having solid answers just yet. Learning to just embrace and enjoy today for what it is, because guess what? I have my vision on both sides today, so it's a good day and I'm gonna just enjoy it. We're gonna weigh the pros and cons of each recommendation and look at the big picture. What is, like, yes, short-term adjusting to visual deficits and that sort of thing sucks, but if it gives me my life like a long life, hopefully. Just weighing and understanding that. And then it boils down to finding the very best. This is, if it was an arm or leg, I would probably shop around. But this is my brain. So that sun is getting rough again. This is my brain. I don't want okay. I don't want good. I want excellent on who is poking around and operating in my brain. it's it's comical that you never think it's going to happen to you, but just the fact that I am choosing who is going to go into my brain at 24 years old with a 6-month-old baby is it's a fucking joke. Like, so with that said, we are waiting right now, waiting for the tumor board recommendations, and then we need to choose a treatment plan, and then we need to choose a surgeon to do this. And that's where we're at. So thank you guys so much for watching. Sorry that it got a little emotional in there. I appreciate your love and support more than you know. Chris and I are so thankful for the community, both vocally and through the internet. Your support, your kindness, your comments, your prayers mean so much to us. And thank you for watching this video because it supports my family in the short term during this time of need. So thank you very much. And I will see you in the next video, which will hopefully be happier. So yeah, thank you.